COVID information is always changing. We have some questions.
If so many people have their vaccines, why is there another COVID wave?
I was also hopeful that receiving the vaccine would mean the end of the COVID 19 pandemic. But like all viruses, the COVID 19 virus has changed over time. And the most recent type of the COVID 19 virus is called the Omicron variant. The vaccine can make it less likely for a person who receives the vaccine to get sick. But with the Omicron type of COVID 19, you might still be able to catch COVID and spread the infection even if you've received the vaccine. The vaccines have done an important job of preventing people from getting very sick or needing to go to the hospital because of COVID-19 infection, which is very good news. So the vaccines do work. They prevent serious illness, but we still need to be careful about spreading COVID infection, especially to people who have not had their vaccines, such as young children, or to people who have other health problems that make it harder for them to fight a COVID infection.
What happens if someone I know gets sick?
Lately, more and more people that I know personally have been infected with COVID-19. And I can understand how one person might feel worried or concerned about someone when you find out that they're sick. The good news is that if the person's received a vaccine, they're much less likely to get a serious infection that requires them to go to hospital or need medication. So that can help calm my worries, at least. They may just have symptoms that are similar to a cold or no symptoms at all. The person who had the COVID-19 infection will need to stay home for 5 to 10 days as well. It's important for them to stay home so that they can get well if they have symptoms, but also to protect you and other people from catching the infection. If you are worried about someone who is sick, and I can understand how that would feel, then you should call or video chat with them if you can. If you're a religious person, maybe you can pray for them. Or if you're artistic and creative, maybe you can send them a card or send them a video message to boost their spirits while they're stuck at home trying to get better.
What if someone who supports me gets COVID?
If someone who supports you gets COVID-19, they will need to stay home for at least 5 days to avoid spreading the infection to other people, even if they don't feel sick. It is important for them to spend time at home so that they can get better and so that they can avoid spreading the infection to other people. Once their period of isolation, where they stay home and away from others, is over, then it's safe to go back to spending time with them like you usually do.
What happens now if I think I'm getting sick? Do I still have to isolate?
Lots of people are quitting COVID right now because it's spreading so fast. If you have any one of the following symptoms, fever, chills, a cough that's new or getting worse, trouble with your breathing, or trouble tasting or smelling something, or any two of the following symptoms, runny nose, a headache, feeling really tired, having a sore throat, body aches, or vomiting or diarrhea, most likely you have COVID and don't need a test. You and anyone you live with will need to self-isolate. How long you need to isolate for either 5 or 10 days will depend on how many doses of the vaccine you've had, your age, and your health conditions. There's a really good guide on the website called Confused About COVID. If you are feeling very unwell or you're struggling to breathe, you can go to the emergency department or call 911.
How do I stay safe if I'm around someone who doesn't have a vaccine?
Over the last 2 years, we've learned about a number of things that can help protect us. Being vaccinated, wearing a good mask like a KN95 or 2 masks, washing our hands regularly, keeping as much distance as possible between us are all ways that can help us stay safe. We also know now that meeting outdoors with lots of air ventilation is safer than being in an indoor area without a lot of ventilation. Some indoor spaces are safer than others, and opening a window a little bit can help. All these different things are like different layers of protection against COVID.
Sometimes I get angry when I hear that someone is against COVID vaccines. How do I cope to deal with these feelings?
It's true that sometimes, especially these days, people are going to do things that make you angry. I know sometimes I feel frustrated with things people do also. But there's a difference between feeling angry and behaving or acting angry. Let me explain. I might feel anger in my body and I'm thinking things that say that I'm really angry. I may be thinking, I wish a person wasn't doing something, or why do they have to do that? Or that is so frustrating, or oh. But that is different than me going over and yelling at that person, or pushing that person, or getting into a fight with that person. Because sometimes when we're angry, we act faster than we think. And if we could just stop and take a breath and think about it before we acted, we might do something differently. So one important thing to do is notice, oh, that's me feeling angry right now. And then take a breath, pause, and think about what you can do in an angry situation. Because it might not be the best thing to yell at somebody when you're angry or to get into a fight with them. It might be a better idea to talk to someone else about what happened and problem solve together in a way that can maybe make things better and also help you not to get into trouble. The other thing that I find helpful when I feel angry is to remember that I might see somebody doing something and I don't really understand why they're doing it. And it really frustrates me. But maybe if I understood what they were doing, it wouldn't make me quite as angry. So sometimes it's good to have a conversation, to learn more about what's going on with another person, to better understand them, and it can make you feel less angry.
There are less COVID rules now, and bigger crowds of people will start to gather again without masks. I feel anxious about it. How can I cope?
These days, there are a lot of things that can make a person feel worried or anxious about how to stay safe and what things you can do or not do, because the rules are changing and it might make us feel less protected. Now, some people don't worry about these things. Maybe they're not worriers. Maybe they feel very healthy. Maybe you worry more, or maybe you can get sick more easily than other people. So as the rules are changing and things are opening up, if you notice that you feel worried, one thing I think that can help is just saying, hey, I'm worried. What do I need to do to take care of myself since I know that I'm feeling worried? Can I be kinder? Can I be a little gentler with how many things I have to get done today? Can I take my time doing them? Should I tell somebody who knows me well that today is a more worried kind of day? And maybe there won't be quite as many things that I have to do that make me stressed out. If I talk to somebody I trust about feeling worried, they might have some ideas or strategies of how I can feel a little bit safer. Another thing that helps is remembering that there are some things that have worked before that we can do now that can help us feel safe. So if I feel worried because I'm going somewhere and another person isn't going to be wearing a mask, I might feel safer if I wear a mask. And that's okay, I can do that. If I know that I feel worried about being indoors with somebody, especially if I don't know if they've had their vaccine, and nobody needs to show if they've had a vaccine anymore, I can say maybe we should do something outside. Or I can say, I don't know if I feel up to doing that today. Everybody's going to make their own decisions about which things they feel safe doing and not doing. And if you feel worried about doing something that someone else feels safe doing, that's okay. You don't have to do it.